Welcome back to Fox 43 Morning News. It is 8:40. The head of Pennsylvania's Human Services Department will be leaving at the end of the month. Governor Wolf recently announced that Teresa Miller will be moving to a new opportunity outside Pennsylvania. Secretary Miller is our guest this morning on the Fox 43 Capitol Beat. Good morning, Secretary. Thank you for joining us.
Good morning. Thanks for having me.
Yeah, let's start there. For those who don't know, why are you leaving the administration and where are you going?
Well, first of all, I have been so blessed to have this opportunity to serve Governor Wolf and serve the people of Pennsylvania. I have loved every minute of it. And I'm leaving because obviously the governor's term, is going to come to an end here in the future. And as I started thinking about other opportunities, this opportunity in Kansas came up. I will be going to Kansas to be the CEO and president of the Kansas Health Foundation, where the good news is for me, I get to work on a lot of the same issues I've been working on here and issues that I care a lot about, I'm passionate about, and really didn't want to walk away from. I really wanted to work on a lot of these same issues. And this is an opportunity to do it outside of state government, but also from a different perspective, philanthropy's perspective. So I'm excited about that.
Well, there's still a few weeks left in your run as Secretary of Human Services, and there's still a lot of questions that I think a lot of people have, some of which will fall on you, some of which will fall on who follows you. And I want to ask you about Senator Judy Ward, who's head of the Aging and Youth Committee, recently wrote a letter to the Auditor General, which you're familiar about. We're showing it to our viewers right now, asking the Auditor General to review DHS and Department of Health policies, specifically in the role that they played in increasing COVID-19 infections and deaths in seniors. My question for you, Secretary Miller, is did DHS do enough for seniors with disabilities when COVID-19 started a year ago?
Yeah, I'm actually really proud of the work that we did over the last year. When the pandemic hit, we all just started focusing on how can we make sure that we're protecting people that we serve, a lot of seniors, people with disabilities, but also how we can make sure we're getting as much help to people as possible. And that's really been our focus. In the days and weeks following the pandemic hitting and everything shutting down, we started a program called what we called eSkip, which was the Educational Support and Clinical Coaching Program, which became a program that the legislature actually allocated $175 million towards, and that became the RICP program, or the Regional Health Collaborative Response Program. And these programs were really designed, particularly when you think about our long-term care facilities. We regulate at DHS personal care homes, assisted living facilities. And these are facilities that are not a medical model like nursing homes, so they often don't have clinical staff. And when you think about a pandemic hitting, this is going to have a huge impact on these facilities. And because they don't have clinical staff, one of the things we did in the early days was connect them officially through these programs with health systems and the infectious disease experts that they have in the health system, so that when they had questions, we could get prepared with them. But also when outbreaks occurred, and obviously outbreaks in congregate care facilities can be deadly, we saw that. But when outbreaks occurred, we had rapid response, and we had experts from these health systems that would go out to these facilities very rapidly and really do whatever needed to be done to contain those outbreaks. So I will say, looking at the data, when we look at the data pre-RICP, which is where we had funding for this program, and post-RICP, there is no question that the work we did saved lives, and it reduced the impact of these outbreaks in terms of the number of people who were positive and then the number of people who ultimately died. So I am really proud of the work we've done.
And then if you fast forward in the days and weeks after the vaccine started its rollout, there were a good number of senior advocate groups that were saying that long-term care facilities were not prioritized enough in vaccine rollout. Why weren't seniors prioritized more in getting the vaccine early, especially when you consider that the long-term care facilities were hit the hardest at the start of the pandemic?
Sure. So, in terms of questions about the vaccine effort, obviously, Department of Health has been leading those efforts. But what we've done at the Department of Human Services is we've actually established a partnership with Rite Aid, where we've been focused on doing everything we can to get the population we serve, our seniors, people with disabilities, vaccine as quickly as possible. I think one of the challenges that we've had just in Pennsylvania, and I think other states, is just supply of vaccine. That has made it difficult to get more and more people vaccinated. But I think I think we've done a lot of good work partnering, and Rite Aid has been an exceptional partner in these efforts to make sure that we can do everything we can to get seniors and people with disabilities vaccinated as quickly as possible, given the limitations of supply.
Secretary, if the issue was not getting enough from the federal government early on, could DHS have done more to advocate for your long-term care centers to make sure that they got more vaccines early on?
I think, we have been. We work very closely with Department of Health. And so I think we have been advocating all along for the people that we serve. But when there's limited supply, there's only so much you can do. We've, I think, done a lot to make sure that the most vulnerable in the vaccine.
We both have young kids who are similar in age. We've had many conversations before about parenting, about childcare, and we both know just how difficult the last year has been for childcare centers. What needs to happen now moving forward after you leave the department to make sure that daycares can survive?
The good news is that we've been able to get out a lot of support to childcare facilities. I think you've probably seen, as I have, that these facilities have had to work very hard to accommodate the fact that we're in a pandemic. They've had to change all of their operations, and they've had more expenses with cleaning supplies and really making sure that they're doing everything they can to keep kids safe. And they've done a fantastic job of doing so. The good news when we looked at last year is the pandemic didn't end up resulting in more childcare facilities closing than what we saw the year before. But the bad news is this has been a model where we have continued to see childcare facilities closing because it's just a tough business model. So I do think we need to look at increasing base rates, which we've been doing. We need to do more of that in the future. But the good news is also the federal government has provided hundreds of millions of dollars for childcare facilities. We were able to get out over 200 million before. We have another 300 and some million going out now.
I'm sorry, I have to interrupt real quick, and we're up against the clock, but is it prudent to ask families in Pennsylvania to pay more for childcare after the pandemic?
Well, I don't know that families are going to be paying more. I think we've been able to get a lot of aid from the federal government to childcare facilities to really help with all the additional expenses that they're seeing with the pandemic.
Okay, I wasn't sure because you said it might make sense for base rates to go up. So I kind of read that as parents paying more. So if that's not the case, I apologize.
Base rates is for, no, it's okay. Base rates are for us. That's for our Child Care Works program. Okay. It's the rates that we pay childcare facilities, and we're not paying anywhere near what private pay families are paying. So we need to increase what we're paying.
Secretary Miller, thank you so much for joining us this morning on the Fox 43 Capitol Beat, and thank you for the conversations that we have had over the last few years. I've legitimately enjoyed it and wish you the best of luck in Kansas.
Thank you so much. I appreciate it.